the stylopharyngeus muscle, so it gives the a pharyngeal branch, and this pharyngeal branch will add into the pharyngeal plexus over the middle constrictor muscle. And the sensory fibers, they also accompany these muscles. The 9th, 10th and 11th nerve. So 11th nerve also contributes in the formation of the motor fibers to the pharynx and sensory fibers to the pharynx also. So this is how the pharyngeal plexus is formed on the middle constrictor muscle here, and branches from these fibers, they ascend upward to supply the superior constrictor. Middle constrictor itself is supplied because the plexus is formed on it, and the thyropharyngeus part of the inferior constrictor muscle is also supplied by this pharyngeal plexus, which is formed on the middle constrictor muscle. But these pharyngeal fibers, plexus fibers, they fail to reach the cricopharyngeus part, because the cricopharyngeus part is the narrowest part of the GIT. It is only 1.5 centimeter width is there. So this is the narrowest part. So whenever you take hurriedly the food, so food sometimes stuck over between the thyropharyngeus and the cricopharyngeus, because it is the narrowest part. This is the reason why we should chew the food thoroughly, because it has to pass through a very narrow gap, that is the 1.5 centimeter, the narrowest part of the GIT after the opening of the appendix. So number one. Second is there is a pharyngeal nervous incoordination, because the thyropharyngeus part of the inferior constrictor is supplied by the pharyngeal plexus, but these fibers of pharyngeal plexus fail to reach the cricopharyngeus. So cricopharyngeus get more assessment supplied by the recurrent laryngeal nerve, which is nearby. So there is a nervous incoordination between the two muscles here, and that leads to the herniation of the mucous membrane through this gap. So the gap between the thyropharyngeus and the cricopharyngeus is called the Killian's dehiscence. It is called the Killian's dehiscence. So Killian dehiscence is a gap between the thyropharyngeus and the cricopharyngeus due to the nervous incoordination. And through this, a small part of the mucous membrane comes out. This is called the Pharyngeal diverticulum. We call the Pharyngeal diverticulum through this gap, and this is used for the smuggling of the diamonds out. So that is the clinical importance of this Killian's dehiscence part of it. So in this way, we have finished with the pharyngeal tube formation and all the muscles supplied, the nerve supply, origin, insertion, action, as well as the nerve supply. So regarding the applied of it, that if this 9th nerve is damaged, which is a motor nerve to the muscles of the pharynx, then the pharyngeal isthmus, which is the palatopharyngeus muscle. So this muscles of the pharynx, palatopharyngeus, is supplied by the accessory nerve. So, and the 9th nerve also. So when this glossopharyngeal nerve damaged, this passament ridge is not much working, then the food we have taken or the water we are taking may come through this nasopharyngeal isthmus into the nose or into the nasopharynx and the nasal cavity. So this is called the nasal regurgitation. The nasal regurgitation is the result of the damage to the glossopharyngeal nerve. Or, as we know, the 9th, 10th and the 11th nerve, they are connected to the nucleus ambiguous. So as we know, nucleus ambiguous is lying in the medulla oblongata, and it is common, it is a motor nucleus to the 9th, 10th and 11th nerve. The nucleus ambiguous is a motor nerve to the motor nucleus to the 9th, 10th and 11th nerve. As you know, 9th, 10th and 11th nerve, they are arising from the lateral aspect of the olive from the medulla. So all these 9th, 10th and 11th nerves, they are connected to the nucleus ambiguous. And these three 9th and 11th nerves, they are passing to they leave the pharyngeal cavity to the middle part of the jugular foramen together, 9th, 10th and 11th. So they are having the main, all are connected. Because these nucleus ambiguous is made for the supply of the palatal muscles, pharyngeal muscles, the nucleus ambiguous is the motor muscle of the laryngeal muscles, pharyngeal muscles and palatal muscles. All the palatal smooth muscles, the palatal, salt palate, muscles of the pharynx and muscles of the larynx, they are all supplied by the 9th, 10th and 11th nerve. So, and all these nerves, they have got the common single motor nucleus that is called the nucleus ambiguous. So damage to the nucleus ambiguous in the medulla oblongata, damage or damage to 9th, 10th and 11th nerve, it lead to the death of a person, because all the muscles of the nasal, that is the laryngeal, pharyngeal and the palatal muscles, they become paralyzed. The paralysis of these muscles will choke the nasal pathway, the oral pathway and the laryngeal pathway. So when all these three pathways, they are closed, so no air can go in and out of the trachea, and no food can be taken by the patient to the oral. So that leads to the death of a person. So when the nucleus ambiguous is damaged, it's a very serious condition. So after doing all of it, now comes the nasopharynx, oropharynx and the laryngopharynx. So nasopharynx start from the base of the skull, that is the basilar part of the occipital bone, and the nasopharynx ends below at the tip of the uvula. So this is the nasopharynx. The oropharynx starts from the tip of the uvula up to the tip of the epiglottis. So this part is called the oropharynx. Then from the laryngopharynx starts from the tip of the uvula to the lower border of the cricoid cartilage or the upper end of the esophagus. So that is called the laryngopharynx. So pharynx has three parts: nasopharynx, oropharynx and the laryngopharynx. So out of this, nasopharynx is a important part, because so many features are seen in the nasopharyngeal. So that we will finish with the next class only for the nasopharynx. Thank you.